Okay, so let's drop in and learn a little bit more about the Endocator. So as I mentioned, this device is able to read ATP. So it has the ability to understand if there is any type of biological material inside the canal space. ATP is a substance that's present in all living tissue. So it's really a brilliant design to be able to pick up on a molecule that's going to be present inside the canal space anytime there's blood, tissue, bacteria, or contamination that's present. So the way that this works is very simple. It has a kickstand here, so you can stand it up as you see. And when you lift the top, there's a little opening in there that is for this reagent tube. So the way that this works is that you would take the tube, and I'm just going to show you here, I'm going to use my mouth. And then this tube goes down into a reagent in the bottom, and there's a little fluid here. It needs to be agitated quite a bit. So you can really shake it up. And then it inserts into this slot. Once it's in this slot, we'll go ahead and we'll click test. And you'll see within 10 seconds, it will give you an endo score. This endo score scales from 0 to 100. And you can see here, it's giving me a pre-score of 100. And it's giving me a score of 100. And why? Because I swabbed the bacteria directly from my mouth. So it's extremely accurate, and there is a scale that will be able to help you determine if the canals are clean, whether they're maybe contaminated or considered actually dirty. And this will allow you to indicate whether you need more disinfection, more treatment time, more time with solution in the tooth. Really incredibly valuable tool. The only time that this was attempted previously was with bacterial culturing in the 60s and 70s, and those results didn't come up in 10 seconds. So this is incredibly valuable and something I've been using in my practice. For the Endocator, the technique is very simple. Once you have finished your instrumentation and your entire advanced irrigation procedure, whatever that looks like in your practice, it's a very simple way to collect the specimen from inside the tooth. And the way that's done is using just a little bit of distilled water. I've got the VIP irrigating tip, the Voyager tip from Vista here. And you would basically just put some solution into the chamber like so. Then what you would do is you would aspirate that solution back out. And this allows you to collect enough solution to be able to put just a few drops inside the tube here. And so we drop a few drops inside the tube. That's all that's necessary. And the key element is to make sure that the swab collects that material on its way down. You push it all the way in, give it a good bang here on your finger, a little agitation like so, and then place it right into the Endocator. You slip it in, again, simply press test, and it will only take that 10 seconds. So as this is working, you're getting a pre-score, and it's showing me a score of 5. So you can see the contrast between swabbing the inside of my cheek and a non-biological material from this plastic tooth indicating a score of 5, which would be incredibly clean. So I want to show you how it's used clinically because it's really exciting and it's really, really easy to use. So the first step is we'll fire it on. And it does have a color screen that will come up here. And then what we do from a testing perspective is we just take a syringe with just some distilled water. And what we want to do, just a little suction here, we just want to place a little bit of this distilled water within the tube. Yep. Okay. And then what I'm going to do is I'm going to aspirate that solution back out. So it doesn't need a tremendous amount, just enough here, and we have some good canal space here. So that's about all we need there. And then what we do is it has these little testers. So what I'm going to do is I'm going to place just a few drops of the solution inside the tester, just like you see there. And then what I'll be able to do is just take the swab and just carry it down and bring it together. Now it's going to react with a little material in here, an enzyme that will allow the machine to read if there's any ATP. So you can see the Endocator is ready to go. I'm going to lift the lid and place the tube inside and just basically press test. You'll see it gives a little estimate immediately, and it only takes 10 seconds for the reading to come up. So at this point in time, we wait and we see that this says 90. Now 90 would indicate that the canal is still dirty. So what we'll do is we'll go back and do another round of cleaning. We're using laser technology. We're also using the Odney Clean, and we'll do another round and then we'll come back and test it again. So thank you for listening and learning more about the Endocator, and just know that this is a valuable part of any dental practice.